Good morning, everyone, and thank you very much for being here. To the media, make sure we get this information out. As we have done recently with our medical updates, hospital updates, Dr. Robert Roos, the Chief Medical Officer of Mercy Trinity, is here, and Dr. Andy Hartenstein, who's the Chief Physician, Executive, and Chief Academic Officer of Bay State Health Systems, is here. Representative Dr. Mark Kerouac, the CEO and President. We will, after my update, have both these gentlemen come up, and I deeply appreciate that they take the time to be here every Monday to give these important updates. And then after their updates, we'll go immediately into questions for them so they can get back to their respective hospitals of Bay State and Mercy. So, everybody's heard of Murphy's Law. Lately, the run that we've had, but we'll get through it. But have you ever heard of Flanagan's Law, which states that Murphy was an optimist, and we are always optimistic here in the city of Springfield, tested and true. Let me give you a quick update on the cases. These are confirmed cases. So Commissioner Helen, Calton-Harris, and I only go on confirmed cases. So Friday we had 5, Saturday was 4, Sunday was 8. So the good trend continues that we're staying in single digits, though we had an uptick Friday of 13, but I think that was some back reporting coming in. Unfortunately, we suffered 3 more deaths in our Springfield community for a total of 130. Again, from myself and cabinet heads all the way down to rank and file, our thoughts and prayers, sympathy and encouragement to the affected families. Of that, the breakdown, white is 56, which is about 43%. Black is 31, which is nearly 24%. Hispanic is 41, which is about 31.5%. Asians, 1.5 or so percent. Of these passings, 57, or nearly 44%, are from long-term care facilities. 73 are residential, which is about over 56%. The senior food program continues. The deliveries continue to go well. July there was over 1,820 meals. Overall, we've done 14,490 meals to our seniors delivered who requested and in need of that. So we're very proud of that. Governor Baker and Commissioner Helen Calton-Harris will go more into that. Has extended the Stop the Spread initiative. Testing sites now in Springfield will go to September 12th. Tapestry did about 85 individuals at South End Middle School Friday. Helen is also in contact with other testers to get as many as we can here in the city of Springfield. I'll let her speak about that. Governor Baker has put a pause on phase 3, any type of movement to part 2. That's indefinite, that there will be no movement to part 2. In turn, he has moved down from 100 people properly socially distancing or physically distancing with masks outside exteriorly, from 100 to 50, 50. So people are going to have to adjust their plans. That starts tomorrow, Tuesday. 25 is still the number for inside. Commissioner Helen Calton-Harris and I have once again opened cooling centers. I understand on record this is the second hottest summer ever to be recorded here, and it's proven out. I think this is the third or fourth time we've opened up cooling centers. Those cooling centers are going to be open Monday through Wednesday, 12 noon to 6 p.m. Mason Square Library with the community room. That's at 765 State Street. Kennefic, in the north end, Kennefic Park, the fitness center, which is right on Plainfield Street, 310 Plainfield Street, right across from Chestnut Middle School. Again, that's Monday through Wednesday, 12 to 6. Forest Park Conference Room, this is the conference room in Forest Park, adjacent to Pat, Director Sullivan's administration building. You let them know when you're coming in to the park through the gates, if you're coming vehicle, that you're going to the cooling center. If you're in need of that, that's 12 to 6, Monday, Tuesday, and Wednesday. And then we have the Indian Orchard Citizens Council, 117 Main Street, Indian Orchard. That's Monday through Wednesday, 12 to 6. Very popular site because we have the spray pads going there. The Claudio Concepcion Greenleaf Community Center, that's on Parker Street in 16 acres, 1187.5 Parker Street, right behind the 16 acres library complex, Monday through Wednesday, 12 noon to 6 p.m. And then my beloved, the new South End Community Center in the south end of the city, 99 Marble Street. That is Monday through Wednesday, 12 noon to 6 p.m. Again, now normally when this occurs, we have numerous locations open, but we have to follow the COVID-19 rules and restrictions. Plus, the 17 or 18 other sites are being used right now for feeding our students and families with Sedesco and other food providers, and also with the Oasis Food Pantry Food Bank that we do with John Foley and crew at Central High School every Friday, 3,500 families. So that's why we're trying to make sure we have a number of areas, limited number of areas throughout the city. Just a quick update on the, talk about a double whammy. We had the tropical storm hurricane, and then the water main breaks, 2 water main breaks in a matter of days. Eversource, I worked very closely with Vice President Bob Coates and constantly to make sure that we had a strong presence here in Springfield. As you know, Connecticut is still down 90,000 people, but really I'm appreciative. I told them to keep the cavalry here, and they did. I think we're just very scattered sites, could be 37, 47 left, which we'll find out on that, but they're very good moving that. I want to thank Pat Sullivan, Alex Sherman, our forestry crews that were working day and night. Sheriff Nick Cochi, when I reached out, his crews, forestry crews and his crews helped us out also. Governor Baker with Pat Carnevale requested the National Guard. We ended up getting the DCR coming here, so they partnered with Pat Sullivan and his crews to take down numerous trees once Eversource dealt with the wires on water and sewer. Josh Schimmel and to Danny DiDorenzo and Bill Fuqua, to thank you for their efforts on the massive break on Columbus Avenue. And then we had, when I was on site, Dwight and Taylor Street. Friday, I want to give a big shout out to DPW too, Chris Signoli and the crew of Anita Rose and team that were there assisting not only with the storm, but also assisting with the water main breaks. And of course, the Springfield Police Department, Springfield Fire Department, Commissioner Calvey, Commissioner Clapper, who literally were taking calls or were on scene during the storm, hands-on. I really appreciate that immensely. And we will continue to stay on top of that, but we're in pretty good shape there compared to some other communities in Western Mass and obviously in Connecticut. So just brief updates from cabinet heads. Deputy Chief Bill Cochran is here today. They're out 2, police is down 2 with COVID-19. They continue to work their drag racing details. They've hit hard down the north end. There seems to be a little bit of an uptick in the south end, and we'll work with state police to knock that down again. Narcotics, some great arrests and raids were made. Friday, 5 illegal firearms were taken off. Special attention is going with the heat wave we're having. Police have been, Commissioner and Deputy Chief directed to aid in the homeless population, and they're going to sites where they might be. Fire department is in good shape, 0 down with COVID. DPW, Deputy Director Vinnie DeSantis is here representing Director Chris Signoli. No one is down with COVID, 0 there, which is good. They continue all their street activities out there, which I appreciate. They're continuing to pick up yard waste. Again, yard waste will be picked up on our normal recycling days, following all the proper procedures. And Vinnie D has indicated to me they're going to bring on extra crews too to try to get this yard waste picked up as quickly as possible on the recycling days, following all the proper procedures. And Vinnie can go into that. So we appreciate the patience and understanding of our residents. Superintendent Dan Warwick, again, we have had a number of meetings pertaining to school reopening. A vote of remote opening to start just for the first quarter has been put across. We've also brought in industrial hygienist Bob Kirshner, who was very helpful to myself, Helen, Pat Sullivan, and Tim Sheehan when we put together the state-of-the-art homeless medical triage tents for the beginning of COVID. So he's doing an examination of all our buildings. This goes on COVID-19 standards. Prior to that, all our air quality is good, but these are different standards now with COVID-19 temporary standards moving forward. Superintendent Warwick probably speak. They're continuing to survey parents. They're doing surveys with the parents. Meals. We have now served 2,140,812 meals, Monday through Friday and into weekends, breakfast, lunch, dinner, snacks, and we're doing some sites for evening servings also. Just this weekend, 86,362 meals went out to families and students of the Springfield system. I want to thank Pat Sullivan. I want to thank Helen Calton-Harris. They worked very closely with Superintendent Warwick and his team and myself, being at many, many meetings when it came to following up on the schools reopening. And I thank them for their efforts. We will continue, and hopefully the feds and DESE will continue to work with us. There have been threats put on the table of taking funding away from school systems. We're hopeful that they renege on that and realize that we're doing the best of our abilities to keep our students educated, and as soon as it's safe and sound completely, we'll get them back into the classroom. Also wanted to let you know that on finances, revenue, we're down. TJ Plant, my CAFO, indicates to me we're down $5.4 million. The trend is going a little bit better on our fiscal 21 budget, now down $524,000. Deficit had been up to about $7.7 million. And again, I'll spend everything that we have to spend to provide for our residents and business community, and then go after reimbursement, whether on the federal or state level. We've been able to offset about on grants, so we're down to about 5.3 on deficit spending. Pat Sullivan, they continue doing well on the storm cleanup and trees, not only in our streets, but have to deal with our park areas, as Commissioner Calvi will probably speak on. That's been so dry, we have to be concerned of urban forest fires occurring, especially in dense areas. Hopefully it should be all done completely by Thursday. Again, Pat has been working hard on with the schools and his team on the COVID-19 review. Splash pads are going very, very well. With the governor's edict of knocking down to 50 total for exterior events, Director Sullivan will be, as all my other cabinet heads, reviewing permits that have come in or permits that are looking to come in, because they're going to have to be adjusted a bit. Tim Sheehan, my Chief Development Officer on Echo Dev, again, our last push. We're just finishing up helping out our nonprofits. We don't know if and when. We're hopeful that federal government comes across with some more funding for our small businesses, but if not, Director Sheen and I are looking to do some amendments to even get some more money to our small businesses. That's just their lifeline. I ran into the owner of Howard Motors, been up at State Street in the square for about 50 years at an event, graduation event, and he could not be more thankful. He said, Mayor, if I didn't get this prime the pump, I don't know how the hell I would have kept the lights on. So that's what it means, and we appreciate that. At Pakula, again, the legal update that came early this morning, and attorney, HR director, labor director, Bill Mahoney. Travel restrictions are changing. So that should be noted. We've obviously made the notations here with our city workforce if and when someone has to travel for any reason. So those restrictions are changing from states that are changing how you can enter or not come in, or how you come back to Massachusetts, whether quarantined and or have a test ready to go. Early voting, and I want to thank my commissioner, election commissioner, Gladys Iola. We've been working on that, and we just got the update today. Early voting will start Saturday, August 22nd. City Hall only. Right down here, 12 to 8 in the break room. Sunday, August 23rd, City Hall only, 9 a.m. to 5 p.m. Monday, City Hall, 8:30 to 5 p.m. And then I'll move to we'll have a second location, the Claudio Concepcion, the Greenleaf Community Center in the Acres, Parker Street. That'll be 10 to 5 p.m. Tuesday, August 25th, City Hall again, 8:30 to 5 p.m. And then also we'll have the Claudio Concepcion Greenleaf Community Center, 1188 Parker Street, 10 to 5 p.m. Wednesday, August 26th, City Hall once again, 8:30 a.m. to 7 p.m. And again, we'll have the Claudio Concepcion Greenleaf Community Center, 1188 Parker Street, 11 a.m. to 6 p.m. Thursday, August 27th, City Hall, 8:30 a.m. to 7 p.m. And once again, the Claudio Concepcion Greenleaf Community Center in the Acres, Parker Street, 11 a.m. to 6 p.m. And then Friday, finally, August 28th, just City Hall, 8:30 to 4 p.m. And that's our early voting. So that's a quick, brief update on the situations pertaining to COVID and some other ancillary situations pertaining to the city of Springfield. Again, I'm so very happy and pleased that Dr. Roos and Dr. Hartenstein take the time to be here. So first I'll bring up Dr. Andy Hartenstein from Bay State Health Systems. Again, he is the chief physician, executive chief academic officer, to give a update pertaining to Bay State Health. Dr. Hartenstein, thank you.
Thank you. Thank you, Mr. Mayor, and your team for all the leadership during the last 6 months and beyond during this pandemic. And also thank you to our colleagues at Mercy and Fire, Police, EMS, Public Health, Commissioner Calton-Harris, and everyone else contributing. I have to say, I'm filling in for Dr. Kerouac, who couldn't be here today, but I, like he, am proud to be a resident of this region, of Springfield, and of the greater Springfield area, and of Massachusetts for the way we've handled this pandemic, in my eyes. Really exemplary work throughout the state, actually from the governor on down. I'll give you just a few numbers about our current situation and talk a little bit about mitigation activities, which you've heard probably dozens of times, but it remains important because they're proven to work. First of all, in the United States, as you know, we've got more than 5 million confirmed cases now of COVID-19. That's probably a gross underestimate because A lot of people just don't get tested because they have either no symptoms or few symptoms or can't get tested. 163,000 deaths in the United States, which is between 20 and 25% of the world deaths from COVID-19. So that's a sobering fact that's quite disappointing, but also should stimulate action and further action on the part of all communities. That's a lot of people who've suffered and a lot of families who've suffered related to this scourge. I'm afraid it's not over. This pandemic is not over with us. It's just taken a little bit of a hiatus, thankfully, due to a lot of mitigation activities that have been practiced in the state of Massachusetts and in our region. In Springfield at Bay State Health, our system, which as you know is 4 hospitals and about 90 practices across 50 sites of service throughout Western Massachusetts. Right now there are 28 inpatients at Bay State Health, all of them at Bay State Medical Center with confirmed COVID-19 infection, but only 1 in the critical care unit, which is a major victory actually for keeping patients out of the critical care unit if they don't absolutely need to be there. That's a much lower number than we saw percentage-wise back in March, April, and May. There was a much higher percentage of the need for critical care. I can't tell you exactly why that is. We are doing a better job as a nation in caring for these people as more treatments become available and more maneuvers become available, but also the number is low enough that it would, statistically I wouldn't want to make a whole lot out of that proportion at this point. You're well aware that there was a small cluster within Bay State Health that has now been fully contained. I think Dr. Kerouac spoke about that last week. There's really no updates on that. We feel that's been contained. Bay State Health, as are other healthcare facilities in the region, our friends at Mercy and Holyoke and others, these are safe places to get care for people without COVID infection, and I would recommend people not put off necessary care. There's more harm than good that can come from that. If you need care or if you need surveillance for chronic conditions or screening conditions, this is a good time to get it done. It's safe and actually people are being quite vigilant about safety in these healthcare facilities, certainly at Bay State Health, I can say that. We are testing about 1,000 people a day on average over the last several weeks throughout Bay State Health, and that's across all lines of testing. Our rate of positives is about 1.4%. That's a 7-day rolling average, 1.4%. The state of Massachusetts rolling average is 1.8%. So we're just a little below the state of Massachusetts writ large, but in the general ballpark of where they are. Now again, the reason it might be what it is has to do with who's being tested. Again, they're mostly people who are selected groups or symptomatic people or people getting procedures in the future that need to be cleared or people with symptoms or people coming into the hospital. We're also part of the Stop the Spread. We're contributing to the Stop the Spread campaign like our other peers throughout the region. And we've tested just the end of last week about 100 people at the Martin Luther King Community Center and the Edgewood apartment complex in the Brightwood neighborhood. And we will be testing folks at the food pantry this week and others. So we are part of that, but I will tell you, testing is still a national constraint. So regardless of what you hear, I'm here to tell you on the ground, at least in our experience, rapid turnaround tests are difficult to find in any quantity. That's a problem because when you want to make clinical decisions about people, you need a rapid turnaround test to be able to do that, to ensure that you take the appropriate measures. We have 36 of these platforms on order from Abbott. We have not received them yet. We're hoping in the next 6 weeks or so. But that is still a concern, rapid turnaround testing. Mitigation activities, at the extent of sounding like a broken record, the mitigation activities to minimize the transmission of this virus are actually the proven, tried and true public health activities that work. That's frequent and appropriate hand washing, use of face masks, appropriately covering the nose and mouth, social physical distancing to the extent you can. Sometimes in healthcare, because we work intimately with patients and others, you can't do that 24 hours a day, but to the extent you can. Avoiding travel to high-risk areas, avoiding sharing food sources. And again, it's not the food that's the problem, it's the hands and the secretions that are on things that can be the problem if you don't frequently hand wash. Again, this isn't a foodborne illness. This is an illness borne by respiratory droplets, which contaminate hands, surfaces, and other things. So those tried and true mechanisms work. At Bay State, we've taken several more stringent steps even. Our travel policy for first of all, there is no business travel at Bay State Health that's permitted at least through the end of the calendar year. And we'll reevaluate then, our personal travel policy for all Bay State Health employees, and we employ 12,500 people, is quite strict. To get back to work, if you must travel, as you know, the governor has a list of high-risk areas, and it's 43 states, and those numbers will probably increase, not decrease over time. So we are being actually even more strict to ensure that our patients and team members are safe and family members are safe. We've expanded our break areas for staff and eating areas, and you'll see tents set up outside. We have lots of outside areas because it's nice weather now, but when the weather gets not so nice, we have expanded indoor space as well where people can physical distance, yet still take a break in close proximity to their work units, because they need to be in close proximity to their work units. And similarly, we have strict rules on wearing masks, and we have leadership rounding and observing frequently and documenting those observations on the adherence to mask wearing, and it's extraordinarily high, I can assure you. So all in all, I guess the main message I would give is we're in a window where we have some time to plan and prepare. It is likely we will see recurrent surges of this thing. That's just the way it occurs until there's enough immunity in the population, or until we do something to actually change that through a vaccine or some other mechanism to increase immunity. We're going to still see transmission of this virus, and the idea at this point is to exercise those tried and true methods that really help to limit the transmission. And I think you're all doing that here. Hopefully we're all doing that in our personal and work lives. Thank you very much. Thank you, Mr. Mayor.
Thank you. Thank you very much, Dr. Hartenstein. I also want to thank Patrick Leonardo, Operations Director, AMR. Again, he's been a great partner, especially with the homeless, for being here every Monday. Now I'll bring up the Chief Medical Officer for Mercy Hospital Trinity, Robert Roos.
Thank you, Mayor, and thank you to your entire team for all the work certainly amidst the many challenges of last week. And I do want to specifically recognize Superintendent Warwick for what I know has been very careful consideration to do what's best for students, teachers, and our community. I want to acknowledge that all throughout this pandemic, you, Mayor, and your entire cabinet have really shown a clear commitment to following the science, gathering an understanding of the data, and being able to make very tough decisions in a direct and thoughtful way. The reality, as was mentioned, is that as a community, we are still amidst the pandemic, and we have a long way to go. There are going to be many difficult decisions to make, both as individuals and together. And I'll share with you, this weekend I personally spent much of it talking with my family about a decision regarding returning to school. I have a brother who's a widower and a single parent who has 3 school-age children. I have a sister and a brother-in-law who are both teachers and have their own kids and worried about the risk for themselves as well as their kids and those that they educate. And I have parents who would largely be responsible for childcare or remote teaching, and would be at risk if they acquired COVID. And so they've made the decision that they're going to wear masks and eye protection in all situations and interacting with their own grandchildren. They live in the state of Illinois, a state that has had a low test positivity rate of under 2% in the past, but has seen increases of now approaching 5%. And the reality is that as things reopen and as we confront and families confront this decision regarding returning to school and others, it's one that is fraught with trade-offs. It's one that comes with risk, and it's one that's full of some unknowns. We know that the coronavirus is still very much present here in our community, and that we must remain vigilant and reinforce the actions that reduce that transmission. Dr. Hartenstein mentioned the United States has now had more than 5 million confirmed coronavirus infections, which grossly underestimates the real prevalence. Across the world, there's been approaching now 20 million, which is, again, also largely underreported due to lack of testing. And we've seen a tremendous amount of tragedy and loss compared from this illness comparatively. Of note, there's also been some studies that have been released over the past several weeks that highlight the importance in the fact that asymptomatic individuals can spread this disease. There have been studies shown that individuals with no symptoms at all, including if they don't even develop symptoms at some point later in the disease, can have very high levels of virus, as well as the genetic material does not degrade much faster, if at all, than those that develop symptoms. And that holds true both for adults and for kids. There was also a study released, or a projection of a model of the impact on mortality that COVID could have through the rest of this year. University of Washington updated its model and projected that we could see as many as 300,000 deaths from COVID this year. Looking at test positivity rates, numbers of hospitalizations, and the adherence to things like wearing of masks in all communities. That would put COVID as the third leading cause of death in the United States after heart disease and cancer. More than 4 times that of the leading cause of accidental death, which is drug overdose, and would far outsize the number of deaths that we would expect or see in a typical year from a respiratory illness like influenza. And so with that, this week at Mercy, we have started to have some increasing level of concern as we approach the fall and winter, as the data would suggest that we are at a critical juncture. We are at this key point where what we do will have a big impact on how this looks going forward. Over the past several weeks, the Commonwealth had started to see where the trends were not always heading in the right direction, where the test positivity rate had ticked up slightly and now has leveled and started to tick back down. But that was delayed and followed by a slight increase in the numbers of hospitalized patients across the state. And we know that with increases in interstate travel, larger gatherings, a pending return to school at many different age groups in different areas, and incomplete community adherence to masking and physical distancing, we're almost guaranteed to see an uptick at some point in the future. At Mercy Medical Center, while our numbers remain comparatively low, we have continued to mirror the statewide trends. As of this morning, we have 6 confirmed positive COVID cases and 2 which are in our intensive care unit. We have now performed more than 29,000 tests and have had a test positivity rate over the last week of 2.0%, which is a slight increase from weeks prior. And so our focus has remained on reinforcing and bolstering the things that we've done to ensure safe care for all. We are going to continue to operate. We're going to continue to provide care in a world that has COVID infection, and soon in one that has increasing numbers of influenza infections, but also a world that has a lot more non-COVID related conditions like heart disease, stroke, cancer, and many other things. So I just want to remind everyone about a few of the measures that remain in place in our healthcare institutions across the region. At Mercy, we continue to require masking of all of our colleagues, patients, and visitors. We continue to test all patients prior to any inpatient and outpatient procedures and for those coming to the hospital. And we continue to test about 400 to 500 people per day. We have completely minimized any in-person gatherings and moved much of our care to remote virtual platforms and continued to enforce and reinforce telemedicine. For people coming into care, we continue to maintain both COVID and COVID-free zones. And in the last 2 weeks, we've implemented a few new things to ensure safe care. We've made a change in how we manage patients that are coming to us from other facilities, whether it's acute care hospitals or long-term care or skilled nursing facilities. And despite negative testing upon admission, we're continuing to isolate them while they receive treatment with us for up to 14 days, keeping them in a private room and having staff wear the appropriate PPE and testing again upon discharge, to ensure that we account for the incubation period that can occur if somebody has had a prior exposure or is at risk of exposure prior to being admitted to the hospital. Because we believe it's important to put an additional layer of protection in for our patients and staff during this key period in our pandemic. We've also made changes to the physical layout of our facility. We've opened up areas for outdoor seating for colleagues to eat their meals underneath a covered structure. We've reconfigured break rooms, and we're using visual management to cue people to stay the requisite 6 or beyond feet in between, and always to wear masks. We instituted a travel policy a few weeks ago that aligns with Governor Baker's and ensures either quarantine or additional quarantine and testing before any colleague returns to work, and ensuring that occupational health evaluates anyone's level of risk before doing so. And we continue to emphasize the importance of limiting access to our facilities. And I know that this is a challenging one, but we have continued to maintain visitor restrictions. We've continued to allow only 1 visitor for inpatients and surgical patients, and no visitors in our emergency department, cancer center, ambulatory areas, or rehab unit. I just want to say for a moment, I know that this is difficult. As a healthcare provider who's been with patients and families amidst very challenging decisions, I certainly know the impact that an in-person meeting can have. A hand on the shoulder, or a supportive glance or smile. As an individual, I also know what it's like to have a family member die of COVID without any visitors allowed. It's not easy. It's far from ideal. Many of us also know what it's like to revise or change our travel plans, or have to quarantine from family members. So many others have had their work lives dramatically altered, taken pay cuts, been furloughed, or even lost their jobs. We've all changed what our social lives have looked like, and we've gotten accustomed to wearing masks and not seeing people smile in the same ways and frequency that we used to. But in talking with my family this weekend, in thinking about my 11 nieces and nephews, my own son, my parents, and you, as the community that we serve, and your loved ones, I'm reminded that we confront these difficult decisions, that we adjust the ways in which we interact, and that we change what we do, not because it's easy or because we have to, but because it's because we care about each other. And it's because we value and believe in the strength of the community. And we want to see that community flourish now, in winter, next year, and beyond. So at Mercy, I can assure you that we will continue to be here for all your healthcare needs, provide safe care to you, and we will treat you like family. So please do adhere to the public health recommendations. Wear a mask, practice hand hygiene, exercise physical distance, be cautious about who you interact with and when, and if need be, restrict or change your travel plans. These actions do work, and if we employ them together and universally, we will emerge stronger. Thank you.
Thank you, Dr. Hartenstein. We'll now open it up to questions. Dr. Hartenstein, if you want to go questions of the media so that these gentlemen can get back to their respective hospitals. Paul?
Governor Baker, as everybody noted, on Friday announced a pause in phase 3. There were some calls from physicians in the Massachusetts Medical Societies and epidemiologists last week urging the governor to a rollback as to where we are in the reopening. What's your opinion on that?
You know, all throughout, I would recognize that Governor Baker and the Executive Office of Health and Human Services and the Department of Public Health have done a very good job of incorporating data into their decision making. And I, at this point, have no concerns about where we stand in terms of our current phases, and would recognize that if there was a need for us to change that they would incorporate that data. So I personally think it was appropriate to consider a pause on not moving forward more aggressively while we see what the test positivity and the hospitalization numbers look like. But support the fact that we are going to be living with this for some time and continue to operate in a safe way going forward.
Dr. Hartenstein?
Yeah, thank you. And I agree with Dr. Roos, and you know, the governor and his team and the state's team actually has been, I think, extraordinarily data-driven and responsible, really listening to the science, but also understanding that there are a lot of unknowns and trying to respond and proactively respond appropriately, and I think they've done a good job of that, so I have faith that they're making the right efforts there.
Thank you, Dr. Hartenstein. Doctor?
Question for both doctors, so I want to take it first. When the governor kind of rolled back his outdoor gathering, and he said a lot of it was due to large private events such as cookouts, birthday parties, which we're seeing a lot of this time of year, especially with the warm, clear weather. Well, besides the storm, you know, it's going to be hot this week. A lot of people are having pool parties and things like that. Is that a trend we're seeing out here in Western Massachusetts? Maybe by talking to patients, contact tracing, are some people getting the case because of those gatherings? And I guess how can those gatherings, how bad of a spread is it?
Well, the questions about large gatherings, look, I think there's risk. Statistically, every time you're in a room with one person, there's some risk, so you just multiply that risk, and sometimes it's exponentially multiplied with a positivity rate in the 2% range. 2 out of 100 people in that room are likely going to be infected, right? At least, depending on who the 100 people are. So there is risk, and you minimize risk by minimizing those gatherings. I understand we're all tired. I mean, pandemic tired, right? Everyone is exhausted. They want to go back to their normal lives. You know, I sort of liken this to the way we were in September of 2001. You may remember, after that, airline travel has never been the same. Certain things we do in life, we sort of went back to a pseudo-normal, but it was changed from what it was on September 10th. And I think this pandemic has changed things. We're going to think differently about certain things. And large gatherings, at least for the time being, there's no question they will increase risk just by nature of the beast. And so minimizing those, by definition, minimizes your risk. And I know at Bay State Health, for instance, we're still operating under a stricter level in the healthcare system, which is less than 10 people. And even then, with appropriate physical distancing and masking. So to Dr. Roos's point, pretty much everything we do now is in a remote environment, be they conferences, meetings, grand rounds, educational activities, and patient visits. A lot of that is in a remote environment for that reason.
I couldn't agree more. I couldn't agree more with Dr. Hartenstein. You know, the larger the gatherings, the more the risk. Certainly, outdoor gatherings may present less risk than indoor gatherings, but I want to stress that, you know, even if we know people, or we think we know people and we're friendly with people, it doesn't necessarily know that we appreciate the risk that may be present in any large gathering. And so, even if you're interacting with individuals, whether it's 10 or 20 people, you still should adhere to the same public health practices and maintain distance and wear masks. And And that's really the best way that you can ensure your own safety and the safety of your loved ones. It really is about that. And we will have to exercise additional concern as we approach the season where cookouts and pool parties are much less common. And we get to cold weather, and people are going to spend much more time indoors, and we're going to have to be perhaps even more vigilant during that time as well. So to Dr. Hartenstein's point, there's a level of tiredness here, but I know the work that Bay State Health and Mercy Medical have done with our own colleagues in supporting resilience and continuing to send this message out to the community is critical as we get through this.
Any other questions? Matt?
Dr. Sarno, I'm wondering if you might be able to comment on, I look at the data every day on what's going on, where the cases are county-wide, and it does seem to be consistently a smaller increase, if any, in Western Mass compared to the rest of the state. In other words, some of the spike that we've seen principally has been driven elsewhere. I don't know if you want to offer any insight as to why it is that somehow we're just not, doing it as badly. And I think at this point the density argument has kind of been, rejected since we've seen outbreaks in so many rural areas. But I don't know if you want to have any, thoughts about this. I know I've asked this before, but if you want to.
Dr. Hartenstein? Dr. Lewis?
Sure, I'll say a word and then turn it over to Dr. Riz. Well, I think there's still an argument for the per capita density, actually. I think that you will still get variances, but I think that is one argument. The second argument, which we'll never be able to really provide evidence for, has to do with importation of cases. Where are those people coming from, and where do you get more travel to? Obviously, the eastern part of the state tends to have a higher density of people coming from elsewhere. Keep in mind, the United States is a free country. We like it that way. We like to be able to move freely between states. That's part of the joy of living in a free country. It also brings with it some risk, which is why the governor and other governors in states with currently lower incidences have put tighter controls in place, but there's still self-enforcement. It's difficult to enforce those with the rule of law. So I still think those are possible, and I also think the numbers are still small enough that it would be difficult to draw statistical inferences from them yet.
Agree. I think without looking at all the different pieces of data that would include everything from community adherence to masking and distancing to test positivity rates, it would be impossible to draw a definitive sort of data-driven conclusion regarding that, but many of the same elements that Dr. Hartenstein would support it. Certainly, we know that there have been states that are closer to the eastern part of the state, like Rhode Island, that have seen a dramatic increase in their test positivity rate over 5%, whereas here, where we may be experiencing more interstate travel with Connecticut, where those rates have been lower. So the travel, the reduction of outbreaks related to large gatherings, and the continued reinforcement of the same public health messages is certainly what may be driving some of the relative success here in Western Mass.
Any other questions from the media? Hearing none, Dr. Hartenstein and Dr. Lewis, thank you.
Thank you, Mayor.
So much.
Thanks, Mr. Mayor.
Thanks, Dr.
Thank you.
Thank you.
Thank you.
Thank you, gentlemen.
Governor Sky's back, all right. We're now going to bring up, on the city perspective, the Commissioner of Health and Human Services, Helen Calton-Harris.
Today, I am going to use the chart that shows the cases in the city of Springfield each day from March the 21st until yesterday, August the 9th. What's important is to look at the two-day average, two-week average. On July 27th, there were 8 cases. On the 28th, 3. The 29th, 4. The 30th, 11, July 31st, 5, August 1st, 9, August 2nd, 7, August 3rd, 4, August 5th, 2, August 4th, 2, August 5th, 1, August 6th, 13, August 7th, 5, August 8th, 4, we are beginning a process of doing community testing. The mayor told you that Tapestry tested 85 individuals on Friday. We know that there will be additional testing being done this week by Tapestry. We also know that the governor has announced that the Stop the Spread initiative will continue until September the 12th. It's important to acknowledge that this is something we have asked for. We've asked for additional testing because we wanted to try and understand the penetration of the virus in the city of Springfield. What that's going to mean potentially is that you will see that some of these numbers are going to increase on a daily basis. That does not mean that we are not continuing to do our job, because if you look at these numbers, what's important to me to reflect to the residents of the city, as you have been doing based on the cases that are coming in currently, what we have asked. Everything is in the single digits over the past 2 weeks, with the exception of 2 days. And so we know that the prevention mitigation efforts that are being done across the city are having an impact. I expect to see that these numbers are going to increase as we test. The measure of the illness of the asymptomatic individuals will wind up potentially 10 days to 2 weeks later if individuals wind up in the hospital. So if we see as a result of our increased testing that more individuals are winding up in acute care, in Bay State, or in Mercy, then we know that we'll have some positivity that's happened with some of the cases that we've seen over the last 2 weeks, or we could potentially see. But I wanted to show you this today because I wanted to be clear that we are in this city of doing our job. You are, as residents, working together to keep these numbers down, and we are extremely appreciative. And so the confirmed cases in the Commonwealth of Massachusetts are 112,459. In Hampden County, it's 7,600. The city of Springfield, 2,888. Please remember that these are confirmed cases. The probable cases, and again, those are the cases where there are antibodies and potentially symptoms, but they do not have a positive result, are 8,581, and probable deaths are 221. Now also remember that when we report to you, we are only reporting our confirmed cases. The deaths in the Commonwealth are 8,514, in Hampden County, 707. The city of Springfield is 130 deaths, which is about 18% of all deaths in Hampden County. The mayor has indicated the deaths by race: 56 white, 43, which is 43%, 41 Hispanic, 31%, 31 black, 23%, and then 2 Asian, 1.5%. 73 residential, 57 long-term care facilities. Stop the Spread is going to go on until September 12th. We are working not only with those individuals who are standing up test sites for us this week, but also we have been contacted by providers from across the state who are willing to come and do testing. We think that testing is important. So I would ask you again to reach out. We will, in the next couple of days, be sending out a press release through the mayor with those specific organizations who are going to stand up tests for us. And you will be able to go on and use a link to make an appointment. Tapestry did take walk-ins. We thought they were only going to be able to do 24 individuals. They wound up doing 85. They expanded their capacity. So that's very important, and we look forward to the testing that they're going to do this week. On August the 11th, Tapestry will be at Zanetti School from 3 to 6, and then Friday at Kennedy School from 3 to 6. They are asking individuals to sign up for appointments. AFC Urgent Care continues to do testing Monday through Friday, 11 to 7, and Saturday and Sunday, 10 to 4. I want to congratulate Superintendent Warwick and his team for courageous decisions around school opening. I want to thank my staff and Ms. DeVar and Solo Dennis for working with them. It is important that the superintendent and his team, along with the mayor, took into consideration all of what's necessary to keep our teachers and our students safe. Patrick Sullivan, of course, has had an enormous role in working with the superintendent. And what they are doing is really good public health. They are doing surveillance. They are analyzing and making sure that they are responding to the needs by looking at the schools and looking at the activities within each school. And then they will do mitigation, which is making structural and non-structural changes to be able to make our buildings safe, and they will respond. I think it's important for me to say that air quality and air exchange are two different things. The air quality in our schools is good. To my knowledge, the air quality has been tested, and the air quality is something that has been reported as acceptable and good. Air exchange is a different thing. When you have a virus like COVID that none of us has experienced, it's important to understand what that air exchange is in the mitigation of that virus, and that's the work that is going to be done with the Springfield Public Schools and the superintendent. So I just want to, because I've gotten phone calls, because the Board of Health had a role in signing off on the school department's plans, and we were able to do that because of our relationship with the superintendent, with Patrick Sullivan, with Bob Kirshner, and of course under the mayor's leadership. So we felt comfortable as a Board of Health in supporting the decision made by the superintendent and his team and the school committee. So we are grateful for that partnership. Travel orders continue, and that has been remain in effect. Rhode Island has been added. We expect there'll be other cities and states that may potentially be added. The outdoor gatherings, as you know, has gone from 100 to 50, and so as requests come in, that is what we will need to take into consideration as we approve moving forward. Contact tracing is still very important. Our staff is doing that. Please give us the appropriate information so we can trace contacts and we can continue to hold down the spread to the degree possible and identify those who need to be able to be contacted and mitigated. We have seen individuals who we've asked to quarantine who oftentimes may not comply. If you are COVID positive, you must isolate. You must isolate and stay away from individuals. If you've been in contact with a person that is positive, you either need a negative COVID test, or you must quarantine for 14 days. That has not changed. So I thank you for your cooperation. I want to remind us we are still in mosquito season. West Nile virus is still a virus that is there. Triple E is also a virus that we are concerned about, so continue to use DEET, insect repellent. Continue to keep yourself covered from dusk to dawn if you're outside. It's important that we do that. Remember, the state does have mosquito traps around us, and they gather those mosquitoes to test for EE and West Nile. We are getting ready to enter a 3-day heat wave. It's important to stay hydrated. Stay hydrated, never leave pets and children alone in the car. Make sure that you are looking out for yourselves and your neighbors. This is important. We know that heat stress can be something that is real and impacts individuals' health, especially the elderly. So please remember to take care of yourselves during this heat wave. And finally, our former First Lady, Michelle Obama, recently said that she was suffering from low-grade depression. And she talked about 3 things. She talked about needing to stay isolated, this pandemic. She talked about racial strife across the country, and she talked about the current administration. But I think what's important, if we have a woman who has access to resources like our former First Lady admit to low-grade depression, that should tell the rest of us that many of us are dealing with emotional and mental health issues. So I want to make sure that we understand that and do take care of ourselves in that way. I told you maybe a month ago that it's okay not to be okay. And I think our former First Lady is just making sure we understand even she is dealing with low-grade depression. And so it's been said many times, but it can't be said too many times. Cover your face, use masks, you are making a difference. Hand hygiene, wash your hands frequently, and make sure that you are continuing to physically distance when you can. It is important that we stop the spread, and we are doing that in the city of Springfield. Look at what you're doing, look at your numbers. And so let's continue to keep this trend. Again, we may see an uptick based on testing, but that's to be expected. Thank you.
Thank you, Helen, very much. Thank you, Health Commissioner Helen Calton-Harris. Appreciate that. My Chief of Staff, Tom Ash, has just informed me, we got an update from Director Sullivan, that from what we understand, every house or residence in the city of Springfield is fully powered up. So we wanted to check on that. That's good news, and I appreciate the patience and understanding as we went through these no water and the tropical hurricane storm. We'll now go to the public safety portion of the update, and I will start with Fire Commissioner Bernard B.J. Calvi, a.k.a. Paul Bunyan. He handles himself quite well with a chainsaw. Pat Sullivan is going to put you on the crew there, and he's going to note that it's a special birthday today, too. Springfield Fire Commissioner Bernard B.J. Calvi.
Good morning, everybody. Thank you, Mayor. First, this week we have no one out with COVID-related illness. We do have one member who was quarantined after returning from vacation. He was in Rhode Island when the travel restrictions changed, so is now forced to quarantine upon coming back. This past week we worked with the water department to ensure that there was adequate fire flows throughout the city of Springfield after the water main break. We did have the Westover Air Reserve based tanker in for a couple days while the pressure and volume were coming back up. We had that stationed at Mason Square and actually did use that at one fire to ensure that we had adequate water supply. We worked with the Forest and Grounds Department to help make sure that the open areas are being cleared. What we're worried about now is all this blowdown and slash that's left out in the woods and in the urban interfaces, it's called, which is the forested area around structures, could have a lot of blowdown and slash in it that could lead to forest fires as the summer and the year progresses. This will be more of a problem next year as all this vegetation dries out and becomes burnable. And Congressman Neal announced a new grant program that hopefully the city will be eligible for. So Director Sullivan and I will be able to work together to help them mitigate the urban forest fire danger in the urban interface zone. That brings me to the special birthday I was going to announce while we're talking about forestry and the urban interface zone and forest fires. Today is Smokey Bear's 75th birthday, so the U.S. Forest Service has been using Smokey the Bear for the past 75 years to help prevent forest fires. So as Smokey Bear would say, only you can help prevent the urban interface fires. So we'll go with that one. Lastly, I'm going to discuss the heat advisory that's in place between now and 8 o'clock tomorrow night. We're expecting heat indices in the 90s to high 90s, so I'm asking everybody to look out for your neighbors, look out for the elderly and infirm who have a hard time dealing with these type of weather events. And on a fire front, if you're going to run an air conditioner, make sure it's plugged directly into an outlet. Don't plug it into a power strip, don't plug it into an extension cord. That can lead to overheating and can lead to a fire in your residence. That's all I have for this week. Thank you very much.
Thanks, Commissioner Jones. Representing the Springfield Police Department is Deputy Bill Cochran. Bill, thank you very much.
Good morning. Thank you, Mayor. I can't beat the Smokey the Bear reference. I don't know McGruff's birthday or anything. So in the Springfield Police Department currently there are 2 officers out of work due to COVID protocols. One officer had symptoms and the other officer was exposed while providing medical assistance during his tour of duty. Of other interests, the past weekend, the narcotics unit made several very good arrests on Friday in 2 separate incidents. The daytime shift in the narcotics unit, along with the C3 units and the Massachusetts State Police, executed a search warrant at an apartment on Spring Street where they seized 3 illegally owned firearms, ammunition, heroin, cocaine, and 2 individuals were arrested. Later that same day, another investigation done by the evening narcotics unit led to the legal seizure of 2 illegally owned firearms, ammunition, heroin, cocaine, and 1 individual arrested. Again, very good work on those officers' parts, and again, the continued good work of the narcotics unit and other officers in the Springfield Police Department. We too are also monitoring this heat wave. The Metro unit is under direction to do their best to check on the homeless population in the areas that they usually congregate and go to make sure that everyone that needs medical assistance is provided that. Squad A, the overnight shift, is dealing with the drag racing problem in the downtown area, in the north end and the south end of Springfield. We're getting very aggressive in our enforcement, and I would remind those individuals that are doing that over the next few weeks we'll be increasing enforcement and recommend that they stop their behavior. Other than that, that's all I have, Mayor.
Thank you very much.
Thank you.
Thank you, Deputy Cochran. Another important component that's on many people, especially families' mind, is schools. And Superintendent Dan Warwick and his team have worked around the clock, not only on the remote learning we're currently under, but gearing up to reopen our schools. So without further ado, Superintendent Dan Warwick.
Thank you, Mayor. Good morning, everyone. As you know, we had made a vote at the school committee Thursday night to open for the first quarter with remote learning. And I think put a lot of work and thought into the vote, but with the support of the mayor and his wonderful team, Helen, Calton-Harris, Patrick Sullivan, we collaborated, we worked together for the last several months. Actually, we've been thinking of reopening since March. How are we going to reopen? And how are we, more importantly, going to reopen safely? And with an abundance of caution relative to the health and safety, it's clear at this time the right move was to open remotely for the first quarter and then reevaluate. A couple things came up in this conversation. We were looking at DESE standards from the beginning and complying with DESE standards to open in a possible hybrid model, because of course any team of educators is going to want to get kids back live if they possibly can. But as we looked at those standards and realized we would meet those standards, Pat Sullivan came forward, and again, our Commissioner of Public Health was talking about a higher standard, these ASHRAE standards relative to air flow or air movement. Again, I think the Commissioner made a very good point. This was not about air quality. We've tested the air quality in our building time and time again, and they meet the standards. However, the air movement and the airflow wouldn't be the kind of situation we'd have in all of our buildings to ensure safety, you know, in this COVID-like environment where we have to get to a higher standard. And I think in Springfield we made the decision that our safety of our students and staff is at the forefront, and at this time, as much as we wanted to come back live, and we know there's some folks out there that would like us to come back live, it just wouldn't be the safest, most prudent decision at this juncture. Again, it's only for the first quarter. We're going to reevaluate it, but I commend the school committee for their courageous vote the other night, their courageous unanimous vote when presented with the facts. And again, as the mayor has said from the beginning, the health and science facts, this clearly was the right decision. Again, so grateful to the mayor's team for all their support through this, because believe me, this was a very, very hard decision to make. And one of our school committee members, Maria Perez, put it very, very well. It's very difficult for a school committee member to choose between education and health and safety. But if you're making that decision, you're going to make sure you weigh in on the health and safety side first. We have to protect our students. We have to make sure they're safe, and we have to protect our staff. So again, I commend the school committee in making a very, very difficult decision. It's been very difficult for staff trying to plan for all this, and the staff has worked tirelessly, and we are ready to pivot to a hybrid model when the health and safety of our students, we feel we can meet their needs and it would be appropriate. So we're still working on that. We haven't given up on that. We finished our summer school at the end of last week, very, very successfully. And on Wednesday, August 19th, we're going to have a virtual summer school graduation. Again, we're going to have that event virtually out of an abundance of caution on health and safety for our students and our staff. Since this crisis began, we've been working really hard to meet community needs in various ways. When we closed down in March, since then, to meet the need of the community relative to meals, we have served 2,140,812 meals as of Friday. 86,362 meals for this weekend alone. So again, trying to meet the community need. Another thing the staff has worked tirelessly on is the remote education. And I think Springfield, because of the support of our mayor and our school committee, had one-to-one laptops for all the students in grades 3 to 12 and had the ability to deliver those to all of our families during this crisis in the spring. So we were able to do a much more significant job relative to the remote education. The other thing we had done is, because we made that decision 5 years ago to prioritize in our budget, was provide a lot of professional development for our staff. So they had a lot more experience and training relative to dealing with technology. Not to say we're experts at this juncture, working in a remote situation, but certainly well positioned to move forward. During the summer, again with the support of the mayor, we were able to purchase one-to-one computers for all our students in K2 as well. So we have complete one-to-one support relative to the technology. We've also been working with Comcast Essentials and providing hotspots to give families the connectivity, and we're prepared to make that outreach again in the fall to every family, making sure their students have the technology and they have the support. And we're going to provide 3 weeks of training when we return to school for staff on working with students effectively remotely and being prepared to move to a hybrid model before we open. We'll be opening our remote program on September 15th. So until then, our staff will be doing comprehensive training. Springfield has 5 days of training before school opens. No one else in the state does that, so that's rather significant. And DESE gave us the opportunity for 10 extra days for professional collaboration for staff. So our staff will be working together, again, collaborating and planning and getting professional development so that we provide a very robust remote program for the students until we can bring them back live. I think I've covered everything for now. Thank you, Mayor.
Thank you, Superintendent Ward. And now we'll go to Facilities and Park Management, and that's our Director, Pat Sullivan.
Thank you, Mayor. Our storm pickup is going well. We're about a quarter of the way through the city. All the roads were opened up by Friday. I want to thank the residents for their patience. So as you're traveling the city, you're going to notice debris that is still down, and our goal is to have all that debris picked up by Thursday of this week. I also want to thank Alex Sherman and his crew, the Division of Conservation and Recreation Services, Nick Kochi, and Congressman Neal. As the fire commissioner indicated, the congressman announced potential grant money. So with the permission from the mayor, we requested from DCR, the Urban Strike forestry crews, to come into the city, and we're working with the U.S. Forest Service as well, and that was thanks to Congressman Neal getting the Forest Service right into Springfield to assist us. They will do surveillance of our woodland areas and along our streets to determine additional work that's going to be required from the storm. There's a lot of what we call widow makers out there, a lot of hanging limbs, and if you see anything in your travels, please report them to 311 and we will address them. But their work will be important. It will also help calculate the slash that is in our woodlands as we want to get that slash up. We've got quite a bit from previous storms that have not been addressed, and we're at a very critical point to remove that. Splash pads and cooling centers are going well. I want to thank the park team for all their work, and our facilities team in getting the coolant centers and maintaining the air conditioning so they're available to our residents. As our Commissioner of Health indicated, outdoor events are now reduced to 50. We are going to honor for the month of August any events that were already scheduled because it makes it difficult. Helen and I monitor those very closely, so we're very comfortable with what is approved. But going forward, any events going into September will be reduced to that 50. And then, as everyone stated, we're working very closely with the mayor, the school superintendent, and the school committee. Helen and I are talking daily on this issue of how to safely open schools. And I think it's important to note that the city was going to meet the DESE standards. And in reviewing the DESE standards, Helen and I had some concerns in that they really didn't go deep enough. And we felt, in consultation with Bob Kirchner, we want to meet the ASHRAE standards, and that's the American Society of Heating, Refrigeration, and Air Conditioning Engineers. We now need to go through our 57 school buildings. We will do an assessment of those buildings, and what needs to be determined is either the cooling and heating capacity and how these systems will handle the increased volume of air that is recommended when you're dealing with the management of COVID. Has the superintendent and Helen stated, our air is safe in our school buildings, but this is very different when you're managing under the COVID-19 regulations and you're trying to increase more air. So we're going to work hopefully within the next 6 weeks to have that information back to the mayor and the school superintendent
so the school committee can plan for the rest of their school year accordingly. And I just want to thank everyone in this room for their continued support. And we still have a ways to go, as everyone is hearing, but we will get through it. Thank you.
Thank you, Director Sullivan. I'm going to give a special addition today. My election commissioner, Gladys Iola, and team do a great job. I was just going to speak briefly, not only on the early voting, but the census, the census, the census. You see that Director Sullivan had mentioned, and Commissioner Calvi, Chairman Neal, Congressman Neal, Ritchie, and he's always there for us. The census is huge because it dictates what our population size is. Extremely important. We stay above 150,000. We range from 153 to 155 because that goes to funding sources. And I think Director Sheehan will tell you too on the CDBG, which is a mayor's, he or she's lifeline. So again, it's very simple to do that census. Very limited information is requested. Very, very limited information is requested. We need you to be counted. Everybody has to be counted. If you're not counted, you don't count, which means the city doesn't count. So without further ado, Election Commissioner Gladys Iola, her and her team do a tremendous staff. She'll speak to you about early voting and the importance of the census. Commissioner Iola? She got the appropriate t-shirt on today, too. Thank you, Commissioner.
Good morning. Thank you, Mayor. As the Mayor stated, the census has been our big push for the City of Springfield and the Board of Elections over the past month or so. Really, it's been 2 years in the making. We've been prepping, working on a federal and state level to make sure that Springfield is adequately counted. This week, what we're pushing and what our main focus is going to be is the counting of people for the Springfield Housing Authority. So those neighborhoods have been undercounted in the past, and we're working with the federal census to get a mobile questionnaire answering area in each of the Springfield Housing Authority properties. We think it's important to have that done because these individuals are not coming out in the numbers that we need them to, and typically they've been counted lower. So that's been our big push. We're going to have tables at these places to make sure that any resident that needs assistance in answering the census that may not have access to a computer will have help from the Western Mass team to be able to properly respond to the census and get everyone counted. And as the Mayor said, my t-shirt speaks volumes. We are also doing early voting. So in tandem with the census, we're working on the September 1st primary, and the state legislature has been amazing in that they have really worked together as a team with Secretary Galvin's office to ensure that early voting and mail-in voting have been a priority. We've been funded, and as of August 7th, we had over 10,000 Springfield voters that have requested absentee or mail-in vote ballots, and we're in the process now of mailing those out. So expect, if you have requested an absentee ballot in the past weeks, to be getting one this week. And if you haven't requested one and you don't feel safe or comfortable going to the polls on Election Day, we suggest that you call us or you send that postcard back to us, and we will make sure that we get your ballot to you. This year, more than ever, it's been important for us to collaborate with the school department. We've collaborated with Pat Sullivan to make sure that all of our polling sites are safe, that there is access. City Hall, Springfield City Hall, will be an early voting site for 2 weeks. So if you don't want to mail in your ballot, if you don't want to go on Election Day, we're asking you to come here, vote in person, and we're going to have the staff to man and facilitate anything related to early voting here at City Hall.
We might have questions after, Gladys. Stick around. Thank you so much. Again, thank you to our state legislature, our delegation, Springfield delegation, and special thanks to Secretary Bill Galvin, who was just out here a week or so ago on perpetuating this and the funding sources also too. Our street attack continues with DPW. They haven't missed a beat since this COVID-19 has started, with trash pickup, recycling, yard waste, street, road construction, sidewalks, and storm aspects. So I'm going to bring up Deputy Director Vinny DeSantis, give a quick update and a few words pertaining to DPW activities and what we're continuing to do on the storm cleanup. Deputy Director DeSantis.
Thank you, Mayor. Yeah, right now, our troops are doing everything that we normally do. We've gone through the city with the sweepers. We're keeping up on our road patching. Sidewalks are being installed, and we're also keeping up on the levee system maintenance. As the mayor said, we're going to do yard waste. It's going to be a little more extensive. We're going to have we have some temps coming in because of the storm damage. So the thing is, your recycling day and your yard waste day coincide. You have to bundle up your yard waste no longer than 4 feet and no thicker than 3-inch diameter. And then they'll be around to pick them up. If they're not there on the day of your recycling, that means they're falling behind, and they will get there. They'll have to work a little extra, but they will get there.
Thank you.
Thank you, Mayor.
Thank you, Deputy Director DeSantis. Thank you, Vinny D. Again, as I always state, Springfield's in the business of doing business, and I appreciate the efforts of Chief Development Officer Tim Sheehan and his team. He'll give you an update, and we're going to continue to do, again, we put out millions and millions of dollars of grants to our small businesses, and we put out to our residents for mortgages and rents and utilities. We're going to continue to do what we can on these lifelines. We're hopeful. I know Congressman Neal, Chairman Neal, is pushing very hard for some more federal relief, but in the meantime, we're going to continue to do our part. So without further ado, I'll bring up Chief Development Officer Tim Sheehan and also moving forward on economic development projects. Tim Sheehan.
Thank you, Mayor. Just to double down on the census and the importance of the census, not only does it impact the level of federal funding that the city of Springfield gets, it also impacts many sectors of the economy that get federal funding as well. So please complete the census. I just wanted to mention last week some polling data came out on the impact of the COVID virus on the businesses in Massachusetts. Not surprisingly, the 3 sectors that achieved the highest level of impact in terms of negativity were the restaurants, beauty-related businesses, and retail. Those are the core businesses of our Main Street and our neighborhoods. And as the mayor indicated, we have put forward millions of dollars worth of assistance to try and sustain these businesses in the hopes of additional federal funding coming forward for them. It has literally been a lifeline to many small businesses. The polling data also suggested, and this is not surprising, the impact is felt disproportionately on the minority-owned businesses and women-owned businesses. And I think the aspects of Prime the Pump that have tried to target minority and women-owned businesses was well placed. And finally, it's businesses that have had the highest impact are those that are under $250,000 in profit. So these are really small businesses, and they're really hurting. And to that end, as the mayor indicated, at his direction, we are clearly looking at all of the grant resources that the department has to try and figure out how we can readjust the spending priorities to allocate as much money as we can for the current program year to be directed towards small business assistance. Thanks, Mayor.
Thank you, Director Sheehan. Thanks, Tim. Thank you, Director Sheehan. Ed Papula, solicitor, that was the regular legal update. Attorney Bill Mahoney, Director of HR and Labor. I'm going to bring Bill up, though, because just to give a brief few words, the ever-changing restrictions, not only that we have to deal in the public sector, but on the private sector should be aware of these travel restrictions and what needs to be done. HR and Labor Director, Attorney Bill Mahoney.
Good morning. Thank you, Mayor. I think it is important to know, particularly for our employees and then for everyone else in the city, that the travel restrictions seem to be changing quite frequently. As of Friday, we added Rhode Island to the list of states that if you are returning to the Commonwealth, you need to either have a test 72 hours, within 72 hours prior to your return of the Commonwealth, and it would need to be negative, or you need to quarantine for 14 days when you come back into the Commonwealth. This seems to be changing, at least in my opinion. I think it's going to continue to change as states see higher levels of COVID-19. So before you go, it's a good idea to check the Commonwealth's website, see if they have updated anything with changes, and if they have, you're going to have to plan accordingly. Thank you.
Thank you, Bill. Thank you, Attorney Mahoney. Patrick Leonardo, you faithfully have been here. I don't know if there's any type of update you want to give an AMR or that's up to you.
No, we're currently thankful for the collaboration with the city and the Department of Health and Human Services currently right now, and helping fulfill whatever necessities the city needs within the community with our assistance currently. So it's working well together.
That's my kind of update. We appreciate that, Patrick. With that, we'll open it up to any questions or comments from the media, my cabinet heads or myself. Paul?
I have a question for Pat, I guess.
Director Sullivan?
Did you say you were going to allow events with over 50 people to take place?
There's one that's right at 50, so that's what we're allowing that one to still go forward. And the other events, we are calling them to let them know, like we have carriage house rentals, they're all being called that they have to bring their events down to the 50.
Okay, so nobody's going to, because I think I misunderstood what you said earlier about.
I'm sorry for any confusion.
Okay, so no events, except no events will be allowed over the 50-person limit.
That's correct. We're going to follow the guidelines that the governor's laid out.
Do you have any idea how many that's going to affect if the city is?
I don't have that number right now, but I would assume between the carriage house and just park permits, there's probably 8 or 9.
Okay. And how does this impact splash pad activities and things like that? You also have to monitor that.
The splash pads have been averaging 30 when our attendants have been going out. So, and I personally have been witnessing what's been happening at the splash pads. So I don't see a concern there.
Thanks.
Yeah.
Questions, Matt?
Question for Gladys.
Commissioner Iola, please. Thank you. Thank you, Commissioner.
So just to clarify for people, if you do get an absentee ballot application but you don't send it in, you can still vote early or vote in person. There shouldn't be any problem. Is that correct?
Correct. And to clarify even further, if you don't know whether or not you want to go to the polls, you can request a ballot. If you don't send it in, you can still go to the polls and vote in person.
Is there, in terms of the probably expected higher volume of mail voting that's coming in, do you have, are you able to make the kind of changes that you need in order to make sure that the count goes smoothly? I mean, I'm not necessarily suggesting kind of what happened in New York, but obviously larger ballots on the front will create some additional burdens. I'm just curious about what your plans are for that.
To be honest with you, we had practice back in 2016, so the last presidential election, we had a similar situation where people were able to request ballots by mail or vote early, and those ballots are sealed and kept in our office. We had teams of runners that go to the polls and actually deliver the ballots on election day, and the process went pretty well. It went pretty smoothly. So using that as a model, I think we'll be fine. I think because of the early voting and the mail-in voting, we were able to secure the same polling locations with the understanding that there'll be a decrease in the foot traffic from the actual voters. We've reached out to the non-municipal buildings and secured their cooperation, so they're collaborating with us to make sure that the buildings that are not city buildings are still safe to use. And we've made any adjustments that we need. So the state has provided us with PPE for all the poll workers. Pat Sullivan has been furiously working on creating 140 partitions of the plexiglass. And we've also secured eyewear from Smith & Wesson with the help of Pat Sullivan. So all of those same polling locations will be available to the voters.
Thank you, Commissioner. Any other questions or comments?
I think this is probably for Helen.
Sure. Commissioner Calton-Harris?
Let me see what you got on today. How you looking? Oh, look at the tie matching the shirt.
Wow,
Oh my
thank you.
goodness, you are just too dapper today. How, how can I?
I know. Now I forgot what I wanted to ask.
It worked.
The governor on Friday said that he wants to crack down on bars that are masquerading as restaurants. Has that been an issue in the city of Springfield? What are your plans on that area?
In the city of Springfield, we have not found that there are bars masquerading as restaurants. As you know, the governor is standing up a team of individuals to go across the state to try to support local boards of health in those kinds of incidents, but it has not, to my knowledge, been a challenge for us in the city of Springfield.
Eddie, is Solicitor Papula around? Eddie? You got that? No problem. Helen handled it. Okay, that's fine. Any other questions or comments? Okay. Thank you, everybody. And I want to really give a shout out to the media, the TV media, the radio media, the print media. Thank you very much for getting this essential information out, sometimes daily, but obviously weekly, with these updates with Bay State Medical Center and with Mercy Hospital. I also want to thank the residents and business community for their continued partnership and their patience and understanding. I think Dr. Roos and Dr. Hartenstein and Commissioner Helen Calton-Harris have indicated this has been very wearing on not only public health but mental health and everybody going the extra yard. We had a difficult, challenging past week with the tropical storm / hurricane and the water main breaks, and the residents, again, your patience, understanding, really helped out a lot. We all experienced it, including myself, with no water and no electricity. But this city is resilient, and we've proved it for many, many years, and my cabinet heads all the way down to my rank and file are tested and true. So let's keep doing what we've been doing because it is paying dividends. So I ask you again, please wear those masks. I ask you again to continue to do the hand washing, the hand hygiene. I ask you again, if you don't feel well, stay home. And I ask you again, the social or physical distancing is extremely important. So these measures are paying dividends, and we will defeat this COVID-19 coronavirus, but we're only going to be able to continue to do it with you and your partnership. So, good health and God bless. Thank you very much. Thanks, everybody. Thank you, my sign language individuals. How could I forget them?